Hi, I'm Rene Naylor, sport physiotherapist with over 30 years experience, and today I'm going to show you how to use your Leukotape K for pain in your lower back area. This can also relieve the muscle tension and improve your posture in the area. So what do you need if you're going to do some K taping for a lower back? Leukotape K, as well as I'm going to use some Hyperfix and some Rigid just to show you another technique for the lower back as well. All of this you can find at your Dis-Chem pharmacy or at independent pharmacies. I've already pre-cut my K-tape about 20-25 centimeters, and very important is that you round the edges. I'm just going to do that on the other side. And this ensures that it doesn't come off easily. Now I'm going to make sure that his skin is clean and dry, and I'm going to position him into some flexion. Going to ask him to go into flexion. So I'm placing it just 2 centimeters lateral to the spine, just above the gluteal line. There we go. 20% tension, and then no tension at the anchor. And then I just repeat it, just 20% tension, no tension at the anchor. And then you can come up. And I'm just going to rub it to get the adhesive to work, and you'll see the beautiful rippling effect as it takes tension off the paraspinal muscles. I'm going to show you another technique, but you can use Leukotape K for it. You can use a thicker Leukotape K that's 75 millimeters, but I'm going to show you the technique with the Hyperfix and the Rigid tape. So I'm going to measure my Hyperfix by just going around like that. There we go. But this is not a technique that's just for players or athletes. This is for anyone that has lower back pain, even for pregnant ladies, because it gives you some support for that SIJ. Just going to place it there. And this is just to protect the skin, because I'm going to use Rigid over it. So I'm just going, there we go. And you basically come a little bit to the anterior pelvis. And then I'm going to use my Rigid. And then where I place this is often dependent on where you're having your pain or where you need the support. But this is usually where most of my forwards like to have some support. And then I just go from both ends. And then often the person would tell me that they feel that's sufficient, or they'd like another piece. And, I just go over and do another piece. And then you could use Hyperfix to just secure it in front if you're concerned that it would be, it wouldn't stick. And there you go. You have good support for your lower spine.